Also at today's briefing, Governor Eric Holcomb faced questions about why he is keeping the state in stage 5 as positive cases, hospitalizations, and deaths continue to grow. WRTV's Cornelius Hawker shares the governor's response and perspective on the decision.
At the end of March, Governor Holcomb ordered Hoosiers to stay home because of the coronavirus. When the stay-at-home order ended at the beginning of May, more than 21,000 people in our state tested positive for coronavirus, according to the Indiana State Department of Health. More than 1,200 had died. As of today, more than 1,052,000 Hoosiers have tested positive, with the number of deaths sitting just below 3,800. From the number of positive tests to hospitalizations, medical experts agree Indiana is heading in the wrong direction. That's why some people are questioning Governor Eric Holcomb on if he'll decide to step back from stage 5 of reopening in our state. It was one of the first questions he was asked about in his weekly coronavirus update.
Stage 5 has got nothing to do with any campaign. This has got to do with safely getting back to school, getting our economy fully open to the extent that it can be safely, and that's happening all over the state of Indiana.
For more than 5 minutes, Holcomb defended his decision to keep the state in stage 5.
We know how to fight back. Back to what Dr. Weaver said, we know a lot more about this. We know how to fight back. We know we can control what we can control. And that has to do with distancing, that has to do with masking up, that has to do with good hygiene, all those best practices. So
looking at it from a different perspective, I think we've seen how this virus has evolved over the last 9 months. We don't know how much it is going to evolve in the next 9 months.
That's Dr. Rajat Kapoor with IU Health, who says he and his colleagues have learned a lot about the coronavirus in the same time frame that Hoosiers went from staying home to stage 5.
Several trials that have come out, and even our own experience at IU Health and surrounding hospitals, we've identified several modalities that we can use to help these patients,
which has put them in a better position to treat those who are hospitalized. But to the question about whether or not we should roll back our reopening, Dr. Kapoor says that's up to our government leaders, and all we can do is follow health guidelines that have been determined to work.
We can follow simple precautions, and if we all follow simple precautions, it does not matter.
Working for you, Cornelius Hawker, WRTV.